Hey everyone, welcome back to the Dental Momentum Podcast powered by Duckett Ladd Dental CPAs and Advisors. Jared Duckett back at you with my business partner Bill Ladd. And today we are going to dive into a topic that I think it's pretty safe to say it's top of mind to all you dental practice owners out there, and that's HR. You know, what's been going on for, let's say, 3 months with COVID-19. You get your state mandates on shutdowns, you know, layoffs, furloughs, and then the PPP rehiring and all that. There's a lot of HR questions and issues in there. And I'm sure you've probably had more questions in the last 3 months than you've had, let's say, in your 20-year career. So with us today, we have Kara Kelley. And Kara is the founder and CEO of Clinical HR, an education and consulting firm for dental and medical practices. In addition to building comprehensive HR courses for dentists, Kara also works directly one-on-one with practice owners to cultivate leadership skills, manage employees, establish compliant HR systems, develop policies and procedures, and also manage turnover by implementing competitive total reward systems. So Kara, we appreciate you joining us on the show. Appreciate your time.
No, thanks for having me. This is great. I'm excited about today's conversation.
It's, it's hard to believe actually that you can find time with what's going on right now to squeeze in a 30, 45-minute podcast with a couple of accountants, but we appreciate you being here.
You know, it actually works best for me. I have some CPA firms that want to send me clients, but they're all going to have the same questions. And so I would rather jump on a call with you and get some information out to your clients and then be able to maybe answer individualized questions after the fact.
Yeah, I think that's really the reason that we reached out to you is you know, as CPAs, we do try to dive deep in with our clients, and there were just questions coming up that, you know, we believe in staying in our lane, and there's pitfalls and there's things that you don't think about as a practice owner, or we think about as CPAs, that you really need to go out and find that expert who can kind of guide you through these uncharted territories. And you know, I'm kind of excited to hear, you know, how you've seen this whole COVID-19 evolve from an HR side and then kind of what you're doing. But Kara, why don't you tell us a little bit about your background if you have a few minutes?
Well, I actually started working in 2012 for a dental CPA firm in the Austin, Texas area. And so I developed a really broad business background on dentistry. At the time I was finishing my degree. I have a business degree with a concentration in HR. And I ended up kind of carving myself out a role there as an HR consultant for the dental and medical practices we were serving. And so it was a really great time to work there. I got a really good perspective on the financial side, on the practice management side, and then also, you know, bringing in the HR piece and seeing all of that from a 30,000-foot view. And so it's been fun. I love working with dentists. I love working with dental practices. And so last year I started this firm, Clinical HR. And this is what I want to do. I actually want to do more speaking and educating and working with clients to help them grow their practices in a manner that's compliant and competitive and be what they want it to be.
Yeah, well, you really jumped out. You know, you said you jumped out last year and kind of started Clinical HR. I mean, talk about, you know, a perfect need right now with what's going on with in the past 3 months. I mean, it's perfect timing.
Yeah, that could have gone one of two ways. Some people would look at that and say, I'm not really sure. I need an HR consulting firm when I don't have a team. But I think that actually it was an interesting timing. And I think that I've been able to help a lot of practices during this period of time. And that is great. I love being able to do that. I love being able to help these practices succeed, because if they don't succeed, then I don't have a business either. So,
yeah. Well, kind of, Kara, take us back, and Bill, you can probably remember it too, that day, let's say 3 months ago. I don't have the specific day, but that day for me, and this might be totally different, but that day for me was that night. I think it was a Sunday night. The player from the NBA was tested positive. They canceled the NBA, and then it just seemed to really go really fast with the COVID-19 pandemic. Take us back to mid-March, and how was that like for you? So as an HR professional specific to dentistry and medical professionals, take us back to that day, and how was that like to you?
It did. For the first couple of weeks, people were thinking about how, well, we might have to take a couple of weeks off from practicing. You know, there's been some cases in other parts of the US, and so we might be looking at a 2-week shutdown. How do we handle that? And then overnight we went to, oh my gosh, I have to lay off my entire team.
Yeah.
What do I do? My practice is basically gone. And so it was a very, very stressful time for a lot of people. And I'm sure y'all know that. I'm sure your clients know that. I don't have to say that it's a given. But it really did change very, very quickly. And with the legislation that was coming out, there were several large laws that addressed various aspects of the COVID crisis that passed. And that information was changing on a near daily basis of what was projected, what actually ended up passing into law, and then the follow-up guidance that was issued after the fact was just nearly on a daily basis. And so I knew I have one PowerPoint presentation that I was doing on a couple of webinars about FFCRA, about Families First Coronavirus Response Act. And I was updating that almost daily because every time I would give it, it would change the next day. And sometimes it would change while I was giving it. So.
You know, that's interesting because I go back to that time period too, and just watching the Facebook groups and being part of webinars, people were, it was almost a fever pitch, and it was all about, what do I do with my staff? What do I do with my staff? And you bring up, you know, the Families First Act. That's kind of gotten buried, it seems like. You know, the PPP, the CARES Act came out, and that's kind of what we deal with on our side. But there's still some interesting things that were kind of put forth in that we don't hear about as much anymore. So can you kind of walk us through with some of the practices out there, maybe some of the smaller practices that are listening? What is some of the stuff that's in that act that maybe we've forgotten about, or that has been kind of swept under the rug?
It's a good question. And I was about to say, it's funny you bring that up because it's something I have been talking about again with people as they bring their teams back, because this is not just a, well, if you closed your practice before April 1st, this doesn't apply to you. This is effective through the end of this year. This is effective for new employees. It's effective for part of it. The EPSL, the expanded sick leave, becomes effective on day one of employment for a new hire. The other, the expanded Family Medical Leave Act, paid family medical leave portion of it becomes effective after 30 days. And so this is something that is relevant through December 1st or 31st, 2020 at this point. I mean, it may get extended. There have been some considerations. I know that they're debating on that, but right now it's still just through the end of this year. And I know that some practices can potentially elect to exempt themselves from a portion of it, not necessarily because they're healthcare. I've not seen a specific note about dental practices and the healthcare exemption, but there is an exemption from the EPFMLA portion of it, the paid family leave for the reasons of childcare, that they can elect to exempt, but they need to go about that in a specific way. They need to make sure that they notify their employees they're exempting themselves, and it has to fit certain reasons. They have to be under 50 employees, they have to have it be a financial hardship, and it has to be something that if they get audited by DOL, they need to be able to prove. So it can't just be an automatic, I have less than 50 employees, I can exempt myself. You know, if you've got those PPP funds, it's going to be harder to say that your cash flow is so tight that you absolutely can't allow somebody to take that leave. So they really need to dig deep into that and talk with some professionals and consider whether or not they truly can qualify for that exemption.
Yeah, that's a lot. Yeah, go ahead, Bill.
Well, that is just great information, Kara, because we've heard that from people, that they would go say to an attorney and they would say, hey, you're exempt, you're good to go, you're under 50. So it's almost, in a lot of mindsets, you know, that was kind of like a dark line test, that if you're under 50, you're good to go. But the financial hardship, you know, is an interesting component. I think that's probably why we've actually heard people say they'll go to attorney one time and they'll say you're good to go, and then by the time they talk to him again, they've kind of backed off that position and said, hey, well, maybe you better play it safe on this one. And that could be exactly what they're running the traps on, is with the PPP funds. That's what that was designed to do. So is that really a financial hardship at that point?
Right. And there are two other reasons that they can elect to exempt from that portion of it. But those are a little bit more subjective. So if they didn't get PPP funds, and it's going to be easier for them to say, if more money's going out than coming in, it's easier to say that it's a financial hardship for the practice. But they really do need to talk with their professionals, their HR advisor or attorney, and you guys, the CPAs, because all of that kind of works together. And then the other thing they need to keep in mind is that if they elect that exemption, it does not exempt them from the sick leave portion of this. So they still are required to provide the 2 weeks of sick leave. It can be taken intermittently, meaning if they have somebody who they suspect has COVID, they send them for a test, they can take the couple of days that it takes to get the results back, because you don't want to send them for a test and then have them come back to work. You want them to stay quarantined until those results come back. But whenever that does, they don't have to say, well, okay, you're taking your 2 weeks. Maybe it was just 3 days and they have the rest of it. One of the confusions was the 80 hours thing. It's not 80 hours if it's less than a full-time employee. it's the equivalent of their 2 weeks. So you need to keep that in mind as well. If somebody works an average of 32 hours, then it's 64, not 80. You're not giving them extra time for that. But there again, I have a lot of information out there on this. I can certainly send y'all some slide decks that have more information. The DOL has got some really great info out on FFCRA. They have an FAQ that I want to say is up to like 93 questions that they get answered about all of those things. And so I would suggest people go and check those out before they make any decisions regarding FFCRA. I will say that they absolutely need to have their poster posted. I am still talking to practices that don't have that DOL poster. That should have been up by April 1st. And I know a lot of people were not in business April 1st, but you're back now and or coming back. And so make sure that's up. Your employees do have the right to know what their rights are in regard to FFCRA.
Yeah. So what you're saying is that poster, I mean, there's an updated poster that covers the COVID-19 related issues.
On FFCRA, the DOL, it's a DOL poster. It's on their website.
I see, okay.
I can send y'all the link to that if you want, or I mean, honestly, if you just Google DOL FFCRA poster, it'll come up in a PDF and you just print it off.
Yeah, and speak a little bit, Kara. So, what we're talking about is legal stuff that's came out or acts that have came out. Talk about like state by state. I mean, because every state's different, right? And I know back when we were, we never fielded so many HR questions, and we were so quick to say, hey, contact a professional. But a lot of questions were, hey, I live in this state and I'm running into this issue. I mean, is it pretty safe to say almost all states are different in their, let's say, unemployment law type of questions?
Almost. I want to disclaim here that I'm not an attorney, and so none of this is legal advice. It's just for informational purposes. So if they need legal advice, they should go find an employer side employment attorney that's in their state. But yes, a lot of states do have different laws regarding leave, and so they want to be aware of those. And one of the other things I would also add to that is that the sick leave is supposed to be in addition to whatever their current leave policy is. So if they're already giving a week or 2 weeks of sick leave or PTO, then this is on top of that. So they need to be aware of that. They need to be aware if their state has any mandated leave. It's in addition to that generally. So you want to make sure that you're very well aware, especially in states like California and New York that are a little bit more employee friendly, have some interesting rules, and be very careful with those states.
Yeah. So talk a little bit, Kara, so the clients that you're working with, how have you been really guiding them through the crisis? Are you kind of there as the professional to lean on if they have questions to reach out, or do you meet with them on a set frequency? How are you there to lend a hand and help them in this regard?
For the most part, I've been there as needed, and I've had some that need more help than others. That just kind of depends. If this is not something that they've been doing for a while, if they're not 10, 20 years in practice, this is already a confusing time for them. And so this is something that even if they've been in business for 20 years, nobody's ever experienced in dentistry. So it's really a very new situation for everyone. So in the very beginning, I was trying to answer questions on the laws that were passing out on how it applied to their practice. I was helping them furlough or lay off their teams. And actually before that, I was helping them decide whether to furlough or lay off their teams, because those are two separate concepts. And some of the information that I was seeing coming out from certain financial firms, not y'all, but certain financial firms, was saying automatically lay off your team. And I'm like, hold up, wait a second. There's other options, and that might not be the best solution. So I was helping them determine whether or not which direction was the best for them to go. During the period of time that everybody was kind of in their downtime, I was working with them on creating policies, safety policies, updated dress code policies, things that needed to change for their practice. Are they going to be doing laundry on site? What they needed to consider for those types of situations, depending on how they opted to go with that. And getting policies ready for them to use for their team. Looking at their current existing employee handbooks, because, hey, everybody had this downtime finally that they could look at the employee handbook they hadn't touched in 4 years. So taking a look at that and making updates when necessary there, and getting those ready to go for whenever they brought everybody back. Some states have brought employees back, some are still waiting. And during those periods of time, that's the same thing, what I was doing, helping them with recalling their team, determining whether or not they needed to recall everybody at once or just partial, who was qualified for leave now that they are recalling their team, whether or not they had to give that leave or, make these decisions. One of the big points that I'll say to that is whenever you're in the process of recalling your team, you want to make sure that you choose employees to come back for business needs. You do not want to say, well, this one's pregnant anyways, and so she's not going to be able to come back. We'll just leave her home. This one's over 60. They can just stay home. They won't be able to work anyway. You don't want to do that. That runs you afoul of multiple discrimination laws.
Yeah.
You just want to make sure that you recall people for a business need. And I say, go ahead and recall everybody if you need to, and let them ask for the accommodation. Let them, say, hey, my doctor says I can't stay home, or I need to stay home. I can't come back to work. I can't be in this environment. Let them ask for the accommodation, but make those recalls on a business needed purpose, rather than something that might get you in trouble.
So when you look at that, and you listed off a ton of great services, and I know you've got resources on your website that can help with some of these things, but let's go back to that employee handbook, because I heard, and we were joking around, I think last time we chatted, a lot of people say they were going to do that. That sounds like as much fun as doing your books and records or watching paint dry, right? I mean,
I actually
nobody
enjoy it.
wants to do
So
it. Yeah, you may enjoy it. Nobody else does. What's so talk us through. I mean, when you're helping them, are they putting in um, like COVID-19 specific language as far as safety, or what kind of stuff are you seeing that's really helping protect the practice owners by incorporating into those employee handbooks?
sure. Some of it, we don't really call it COVID-19 specific. We may add a
Yeah.
pandemic policy to some practices, but it's more nuanced in the sense that we're going through various sections of their handbook, like their uniforms. Are they now requiring everybody to wear scrubs so the scrubs can be laundered on site? Their front desk before might have had their own dress code. Their admin staff might have had their own dress code. So we're making that tweak. If they have laundry on site, we're adding that section. If they have, if they don't have an office closures policy, we're adding that section. Anybody that gets one from me has it, but if they didn't already, they do now. Um, yeah, just lots of little things that we're going through and making sure that they have in there, updating sick leave policies if need
Yeah.
be. I'm really encouraging employers now to add more sick leave. I can't believe this is still a thing where, the number one country in the world that doesn't have, mandated paid sick leave, basically every other developed country in the world does. But now with all of this going on, this might be the time at the federal level to say this is something that we need going forward. And these are the reasons why. And so the employers who have policies that don't allow any paid time off for the first year, that's very, very minimal. I don't see it too often, but it's very, very minimal. And it leaves your employees in situations like this where they are sick and they can't afford to stay home. And so they come to work, and they come to work sick, and not just with COVID, with the flu, with everything else that can be contagious. If you have a fever, stay home, but your handbooks will say if you have a fever, stay home per CDC recommendations, and then they don't actually give them the paid time off to do that. And so the practices who don't have those policies, we're really trying to work with to figure out how much that's going to cost. For one, it's less than you think generally, but to make sure that something is in there at the bare minimum for sick leave, because that is really, truly needed.
So you hit on the sick leave policy. So for the dentists out there that are listening, and I'll put you on the spot here a little bit, what is kind of the average or typical sick leave policy that a dentist should have in their handbook on what that looks like?
I have a bare minimum recommended policy that I would give to practices who are starting up, who feel like they can't afford any PTO,
Yeah.
Where they really should be able to accrue at a minimum of 3 to 5 days that first year. And maybe they don't get it instantly. Maybe it's after 30 days, 60 days, 90 days, whatever you want to have in there, but let them start accruing some time to be able to use that first year, even if it's 3 to 5 days for the sick leave. It can be just for sick leave. If you want to separate out your PTO policies and have vacation be a separate bucket that gets started at year one, fine, do that, but at least have some version of paid time off that first year. I also generally also suggest paid holidays that first year as well too, after 90 days, because same thing, if the practice is closing, they don't really have any control over that. They can't come to work, so why would you take income from them? So those are really my very basic policies. However, I have some practices that are very, very generous about their leave.
Sure.
I have one that does 3 weeks after 90 days. Everybody just gets 3 weeks after 90 days. They begin accruing it. And they have a quarterly accrual, which is kind of interesting, but that's a very nice, generous policy. Maybe not quite so much if you're a newer practice, but at least a week or so the first year. And then after the first year, I would start with 2. And personally, I mean, this is completely off topic from COVID. As far as a benefit standpoint, I like to see PTO be a longevity benefit. I like to see that they earn more the longer they stay. I think that helps you retain employees. I think that, rewards the employees who do stay longer. And I think it's something you absolutely can afford to do as you grow in your practice.
So, one thing it hits my radar there, and I know with the way that you kind of help people build out evaluation tools. I mean, a lot of this comes down to hiring the right people and having a level of trust on both sides, and knowing that you got the right person who's not going to take advantage of the system and taking care of them. And I want to get into that. And I think that's a valuable topic. But before we do that, let me ask you a question, and again, to answer to the best that you can. But as we're kind of looking at the PPP, and we deal a lot with that, and like it or not, there's a lot of provisions of that that are related to staff, which is HR, and they've kind of allowed the PPP money, the forgiveness component of it, which was really rigid regarding keeping your same staff and getting their salaries where they were. Now they've given some leeway if you're unable to bring somebody back, or if you terminate somebody for cause. So as you're looking at this post-COVID-19 environment, how would you have people look at termination for cause? Let's say you have somebody perhaps that maybe was not the right fit beforehand. They were furloughed or laid off or whatever the case is, and then you bring them back for PPP, but you realize maybe that's not the right fit. Is that a situation that could be riddled with some pitfalls there, or would you treat it just like a normal employee evaluation?
I honestly like to treat it like a normal employee evaluation. I don't really believe in using situations like COVID to get rid of the problem employee. You should be dealing with those problems as a practice leader, as a manager, on a regular basis. This is not something that you let just continue to slide ongoing basis. That leads into potential discrimination claims whenever you're treating somebody differently than somebody else. It leads to them usually being eligible for some type of unemployment benefit when they might not be deserving of it. If you have somebody, for example, who is chronically late for work, and you have an attendance policy that says that you terminate after the third time in a quarter or whatever, and you don't do that, then they are able to say, well, I didn't know I was going to be fired for being late. We have this policy. I see the policy, but the policy's not been upheld. So I'm surprised that I got terminated. And oftentimes they will get benefits in this situation. So those are something that you want to deal with just in general as a practice leader. Take care of the disciplinary issues that are going on in your practice. There's a reason that they're there. There's a reason we have written policies for these kinds of things. And so, no, I don't really believe in dealing with that using COVID. I do think that if you have a disciplinary issue, you have somebody that came back and you realize now they're not a good fit for whatever the reason, make sure you do your documentation. Make sure you go through your disciplinary process that you have hopefully written in your handbook. Depending on the severity of whatever their behavior is, make sure you walk through those steps and you have that documentation and say, this was truly for a disciplinary reason. This was a for-cause termination. This has nothing to do with COVID. This has everything to do with them not showing up on time or whatever the issue is.
Yeah. Hit on a little bit. So it is a very interesting time for dentists, especially when they were, let's say, forced almost to lay off or furlough all their employees or all their team members. And now that they've reopened or are reopening their practice, talk about how do you communicate to those team members to bring, let's say, all of them back, or it's even tougher when you're just bringing a portion of them back. Talk about how you communicate to those team members, but also, morale is a big deal here, because this is probably, let's say, the first time that team member's been laid off or furloughed, whatever the word, and then also that maybe that team member was a rock star, but you were still forced. Your practice was closed.
Yeah.
Talk about how do you communicate? This is maybe an impossible question, but how do you communicate, and how do you also make sure that morale stays in a good spot? Because a lot of the clients we're talking to, that's a big deal right now. They're reopening, but the morale's tough because some people are back, some aren't. So can you speak on that a tad?
Sure. As far as the process for bringing your employees back, I generally suggest a notice of recall. Like you said, I have resources on my website. I have a template for notice of recall. It's there under my post-pandemic resources. If you don't do something like that, at a bare minimum, make sure that it's an email or text or something that can be documented, that you did in fact recall these employees, that you gave them a specific date, and let them know the terms, whether they're coming back full-time, whether they're coming back part-time, what ballpark average hours you're expecting them for whatever period, so that they have the information they need to submit it to state for unemployment for any changes that go through for that, because depending on how many hours you bring them back, they could still be eligible for partial unemployment benefits. So if you are bringing them back and you just kind of say, yeah, show back up for work, they usually work 35 hours and you only want them working 10, you need to communicate that so that everything can kind of fall into place the way it should. And then also, for you on your side, you need to have proof that you did recall your employees for some of these laws, some of these notices, and for dealing with data unemployment. So I like notice of recall, have a template available if somebody needs it. That's just the technical side of things. The other about morale and bringing people back and making them feel like they're safe at work, I think honestly, it's rebuilding that trust. I think everybody's trust has been a little bit shattered. I think your teams are going to come back feeling a little fractured, because you're right, dentistry is a fairly stable career choice for most people, or it has been. This is not something you generally face in dentistry. I've never in my life had to furlough a team until this last year. And so that's definitely not been fun for anybody, no matter what side you're on. So I think a lot of that comes down to transparency with your team, letting them know what safety precautions you're taking, making sure, hey, you're taking those safety precautions. That's always a good one. Giving them the proper training on any of your new policies and procedures that you have in regard to safety, and just making sure that they feel as comfortable as you can possibly make them. Going at the bare minimum, whatever the CDC is recommending, whatever your state's recommending, that's fine too, but you can always go above and beyond with that, and with some of these others as well, with the leave laws, for example. The law is a floor, not a ceiling. You can always do more than is required. And if that's what it takes to get your team back and feeling safe and keep morale high, then hey, that is worth it. It is worth its weight in gold, because trying to hire right now has been kind of interesting from what I understand in the conversations I've been having with people trying to find hygienists, for example, when many of them have left the profession forever at this point.
Yeah.
So that's going to be interesting. So if you can get your team back, you're going to be in a much better position than if you have to go scramble last minute and find new people and get them trained, not just on the new safety, but on your practice as a whole. It takes far more time and far less productivity at that point. So yes, being very transparent about that, making sure that you are not doing things that are what I generally call outside of the basic human decency things. So one of the conversations I've been having with a couple of practice leaders is about PTO for the rest of this year. If they were accruing PTO, maybe you paid out some of it. I've had some of them say, hey, I have this EPSL I've got to pay for. So is it okay if I just not let them take any PTO the rest of this year? Guys, there's 6 months left in this year. There's going to be other types of illness that are not COVID. I mean, migraines still exist, allergies, the colds, the flus, things like that, they all still exist. And so people are still going to need to take time off for normal sick time, as well as normal vacation, as well as normal holidays. And so bringing people back and bringing them back to an environment where they maybe had great benefits before, and all of a sudden they're supposed to come back, they're in a less safe environment, or they feel it's less safe, and they don't have the benefits that they had before. You've stopped your 401k matches, possibly, you've stopped your PTO benefits, whatever it is that you've done, you don't want to bring people back to that. That is not going to be a morale boost for them at this point. I'm not saying you have to bend over backward and give them, 10 weeks of PTO, but making sure that they are coming back to essentially what was there before, to make them feel like they are still a valued part of your team, that you still respect the fact that they came back, that they are there for you and supporting your practice, and letting them know that. Making sure that your number one communication with your team doesn't end up being complaining, letting them know that you have gone through some things too, but that you're seeing the positive side of this, that that you're going to get back, ramp back up that production and get patients back in the door, and this is going to be as good or better than it was in the past. Having some kind of positive communication with your team to boost that morale, I think that's going to be very, very critical for practice leaders to do going forward.
I think I love that mentality, and taking care, again, it's getting back to getting the right team and taking care of them and making sure you have the best there is. We're big believers in being very transparent and open with your team, and that does include the good times and the bads. And I think that you bring up a good point, that there's a way to balance that you can let them know that, yeah, we've hit a rough patch, and production went down to zero through a state mandate. However, here's what we're actively doing, and making sure that at the end of the day, you're taking care of those people to keep those right people, in the seats, because they are the ones that ultimately, along with the dentist, are going to be what helps you rebound. and making sure you take care of them may require a little short-term sacrifice, but there could be a really nice payoff on the other side of that.
Oh, absolutely. I think that's going to end up being the practices that survive and get through this and come out on top are going to be the ones that could really keep their team together, keep their team motivated, and keep everybody on the same path. And so that positive leadership and not, like I said, not making complaining your number one form of communication.
Yeah.
That people get enough of that on social media right now, honestly. There's plenty to complain about. I
For sure.
believe it. But you don't have to bring that to work. If you bring that to work, they're going to bring that to work. And so I know it's hot. I know the PPE is terrible and uncomfortable to wear. Make light of it. Do something that, makes fun of the situation. Make it entertaining for your team, whether that's, different colored scrub caps or fun little masks or putting your picture on your scrubs to where your patients can still see who you are. Whatever it is, whatever it takes to make this entertaining for your team, for your patients, and for yourself, because keeping your morale high as a practice leader is going to be critical right now too.
Yeah. So hit on probably the number one question I've gotten, let's say HR related now that we're through when we're bringing people back, is they don't want to come back. And you kind of hit on this at the beginning, but you reached out to so-and-so and they said for it could be a number of reasons. I don't feel safe. Mm-hmm. I'm scared I'm going to get the virus, or I've got childcare issues. Or we've heard one where maybe they didn't say this directly, but what I'm making on unemployment is pretty good right now. I don't want to come back. How do you advise dentists to deal with that issue? That's the number one question I think I've gotten so far.
Oh, yes. I've had a lot of those conversations the past couple of months, actually. And that was something that we all kind of predicted. When originally this came out, it was like the 600 was supposed to have been up to 600, and it was supposed to replace 100% of their income, not give them a raise for staying at home. And when that actually passed, the rest of us were like, what? How are people ever going to come back? Well, so when you're bringing people back, there are going to be some legitimate reasons they cannot come back. Childcare being one of them. If, schools are closed still, and I know we're out in the summer, but place of care could be closed. I know my daughter's camps have shut down for the summer, and so she's home with me all summer. That's going to be good fun. There are plenty of daycare centers that are only opening at 50% capacity, or even less than that on some of this. And so, yes, there may be a waiting list where before this person that you employ had care for their kids, that may be that a grandparent had been taking care of them and they are in poor health and don't feel like they can take care of them due to the COVID risk, with you being an essential employee and all, or going back to work and possibly bringing it home to them. So there are legitimate reasons that childcare may not be available for your team. And quite honestly, I actually attended a webinar a couple of weeks ago by a company that places childcare with various companies for their employees. And one of the things they brought up is that this may not go away at the end of the summer. Schools may not reopen in the fall the way that they were in the past. Some of the plans for schools reopening, public school, are possibly doing 2 days on, the rest of the week off, or telework. And so the childcare in general may change going forward fairly significantly from what it was in the past. So all of this has to be taken into consideration. And if you have somebody saying that they don't have childcare, it could be a legitimate concern. And you want to hopefully operate from the perspective that you did hire adults and, that you can trust what they're saying whenever they say they don't have childcare. There are going to be some people who just don't want to come back because they are making more on unemployment than they would at work. And those people, again, send a notice of recall. If they give a reason why they don't want to come back, that's potentially understandable. You do need to possibly accommodate a couple of weeks of leave if that's something that you have in your handbook for a PLA, for example. If it's a medical something or other, or if it's childcare related, you may need to give them a couple of weeks of leave for that. But after the fact, and I would really caution you to speak with an attorney or an HR professional before you do this, but after that, it is possible to say, okay, well, I need this position filled. I need you to, sorry, I can't hold your job for you anymore. If they are able to stay on unemployment because they have a qualifying reason, let them handle that with the state. Most of the states are coming out. I know Texas, I'm in Texas, is one of them that are coming out and saying, if it's a child care reason, if it's a health reason, so on and so forth, then they are still eligible for UI, and they'll continue to draw that until they've exhausted it. And if they can do that, well, let them do that. At some point, it isn't really worth your energy or effort to try to say, well, this person didn't come back, blah, 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 they're staying on unemployment. All right, just cut your losses, hire a new employee, and move on. You need to focus on your practice and the business reasons you need people back. And if, they want to play that game, then it's not up to you. Most states have a fraud hotline, either an email address or a phone number. And if you are so inclined, you can certainly let your state know that you have recalled this person. And again, let the state deal with it. But don't waste your negative energy on dealing with that at this point.
So this is probably a really tough question to answer, but a lot of times you talked about, if people make the wrong decision or make a snap decision and they probably didn't follow the proper protocol. As you're looking on the other side, as far as risk and liability, do you think any context is going to be given to the nature and the magnitude of what we were going through collectively as a nation when we kind of start seeing some of these potential lawsuits or claims maybe arise?
Oh, we're already seeing some of them. As far as that goes, I mean, I'm not a compliance expert. I've done a lot of webinars and talks with compliance experts over the last couple of months. And the information I'm getting from them is essentially, if you have done at least the bare minimum that you are required to do, then it's less likely that you're going to be able to lose those lawsuits, because somebody can say that they contracted COVID at work, but unless you've got a cluster there and they can actually prove that they got COVID at work, then there's not very much to go on at that point. They are going to the grocery store, they're going to bars, they're going to, the gym or whatever that's open now. There's other places they could have certainly contracted it. And so I think it's going to be very difficult if you're taking those precautions, those minimum ones, or if you want to go above and beyond, the safer you can be, the better. I think that's going to help protect you in the long run. Things like masks, for example. Maybe your state does not require every employee to wear a mask, but that doesn't mean that you can't. You absolutely can. You can make that for your front desk, for your clinical team, part of their uniform. You do need to be cautious. I know some of the things I'm seeing from practices that are monitoring their two-stats of their employees whenever they're wearing masks. They may need to take more breaks with those masks, especially those high-end respirators that, kind of recycle their air throughout the day. They may need to have a couple of extra breaks to step outside and take the mask off and get some fresh air, just to keep them healthy.
Sure.
So I would definitely caution on that, because you don't want to have the PPE cause additional problems for your employees.
Yeah. So I'm gonna kind of tangent just a little bit, but stay pretty much on HR. So I mean, the COVID-19 pandemic that's going on, but then also we've got the tragic death of George Floyd and kind of the civil unrest that's going on right now. How should dental practice owners address that with their team?
I do know that there are a lot of sensitive conversations going on right now about race. And some of this, is going to be dependent upon the people that you've hired and how they treat this and how they act. I did have a conversation last week with a practice owner who had received some messages from the community with some screenshots about a Twitter post that her employee had made that was incredibly racially insensitive and used words that you should never say. And that was her question is what do I do? Can I fire this person? My handbook doesn't specifically have a social media policy, but can I fire this person? So I actually put her in touch with an attorney and letting her know that yes, you can. That whole First Amendment freedom of speech really applies to government censorship, not giving you a free license to do whatever you want with no recourse. So you absolutely can, but you want to make sure that you're doing it correctly. She had some other things going on with that one. And so again, I sent her to an attorney at that point. But the employee has been terminated. Absolutely. I think going forward, though, that's going to be hopefully not the norm, that you have employees who are posting horrible things on social media that you have to terminate. But in the event that it is, you certainly want to contact your professionals before making any decisions. And then going forward, you really want to make this an open conversation if you can, and address this with your team, address this with yourself, quite honestly. Unconscious bias can exist even in a practice leader. And so, and it shows up in ways such as your marketing on your website. Do you have diversity on your website? Are you looking at names on resumes and saying, oh, that one's too hard to pronounce, I won't call that person. My patients won't be able to talk to that person. There's some that are obviously less subtle forms of racial bias. I've had one that she sent me a job description. It was the practice leader. It was the wife of the doctor. And she sent me a job description that seemed like it was fairly normal until you get down to the bottom where she said that one of the job requirements was Hispanics only. And I called her back and I questioned her on that. I said, for one, you can't do that. just, you can't do that. But why would you want to do that? And she said, well, we see a lot of Medicaid patients and I need somebody who speaks Spanish. Okay, well, first of all, just because somebody's Hispanic does not mean they speak Spanish. I know many Hispanic people who do not speak Spanish. And on the flip side, I know many people who are not Hispanic that speak Spanish fluently. So while you can absolutely make language, Spanish, whatever language you need, a job requirement, a skill that you need for the position, you certainly cannot have Hispanics only or any other race only listed on your job description. So sometimes those come up a lot more blatantly than the subtle ones, but you certainly want to address that with yourself and with your team in the sense that you have a zero tolerance policy. You enforce that zero tolerance policy. You do not allow racially insensitive marks, whether they're a joke or not, whether they're accepted by the rest of the team or not, to be made on site. Maybe this is something you start talking about with your new hires. This person who made these posts on Twitter for this one practice, she had been a recent hire. She'd actually gotten hired. I think she said her first day was like the day before everybody shut down for COVID. So she was a very recent hire. And this, might have been something that could have come out in the course of a deeper conversation in the hiring process. Now, you can't specifically ask certain questions and you can't make hiring decisions based on certain questions there. But you certainly want to make sure that you are transparent with the fact that you are an open and inclusive employer, that you treat patients of all races and creeds and colors and genders and so on and so forth, and that you accept every single one of them and you treat every single one of them with the same care that you would the next person. And make sure that they understand that and that you will not tolerate any form of racial insensitivity in your practice.
I think that is so well said. And it almost feels like it takes the two concepts of the, discrimination laws that are currently in place and just that human decency conversation that you brought in, that some of this is very specific, that it is, law, and other is just, it sounds like, do the right thing. So what should practice owners be doing to make sure that their process procedures, maybe back to their employee handbooks, that they're covered and that they have this stuff front and center so people know? Maybe that zero tolerance policy, is that a letter? Is it more than that? These are great questions that I think practice owners are going to have as they try to mentally unpack how to be part of the solution to this problem.
It's a policy in a handbook, and most handbooks that I've seen generally has it in your EEOC statement, but taking it further than that, how many practices that you work with do racial sensitivity training? Probably not many. They've got so many that they're doing. They've got their CPR and OSHA and HIPAA and so on and so forth. They have all this other CE that they take. How many of them are really doing racial sensitivity training? There is that type of training. There's unconscious bias training. There's a lot of fantastic resources out there that you can and should engage those trainers or those courses. If you want to do it virtually, that's fine. And have your team be required to take that maybe once a year. Maybe that's something they take whenever they first start, and make sure that's an ongoing commitment to being inclusive.
Yeah, Kara, that is a wealth of information. You've got so many different areas to deal with on the HR, and it's that. This is great. I want to end it. I want to end on one question we always ask, and so, what is the number one thing that a dental practice owner right now should be doing in their practice, HR or non-HR related, to help them gain momentum to build a practice?
I think a lot of practices are going to have to start looking very closely at their policies. I think they're going to have to start looking at their PTO that we've talked about, at their policies related to COVID or what are going to spurn from COVID. And just in general, they need to start looking at their HR processes. One of the things that is now coming up, because people are not able to bring their teams back, is hiring post-pandemic. And some things like whether or not you're going to require a new hire to take a COVID test. Are you going to have, require a negative COVID test before you let them come to work? Making sure that you are very clear that this is an on-site position without a telework possibility, because if you hire somebody and they have an accommodation that they need, you need to make it clear in the first part of that hiring process before you offer them, this is something that's on site. It can't be done remotely. Sorry. If you're going to do those kinds of things, it needs to be done across the board. You really want to work with a professional to make sure you're doing this right. You want to be very careful not to come across ADA, not American Dental Association, Americans with Disabilities Act, ADA discrimination whenever you're doing this, because if somebody has a medical condition, you don't want to not hire them because of their medical condition. You need somebody to come on site, you need them to work, but at the same time, you don't want to run afoul of some of those discrimination laws. So pregnancy, ADA discrimination, so on and so forth, that could come up if you are at the level of employee that those laws apply to. So make sure that you are very careful in your hiring and just your employee policies going forward, because a lot of the stuff that was just kind of overlooked to some degree prior to COVID becomes very relevant right now.
Yeah.
And then I guess the last I would cap on that one is employee morale going forward. I think this has been hard for everybody. I think it's going to continue to be hard. I don't think we're really past this. The projections that I've been seeing, it was not going to be a 2-week thing. It wasn't going to be a 3-month thing. It might be a 6-month thing, and it could be an 18-month thing. There's, a lot that we still don't know. There's a lot that still needs to be done. Whether or not there will be a vaccine or a cure or so on and so forth, all of that is still very much up in the air. And I think that this is going to continue to be a stressor for you and a stressor for your team. And so making sure that you're paying attention to their mental health, maybe looking into getting an EAP, an employee assistance program, some service that, is a benefit you could offer them as an upgrade to your benefits package, figuring out how you can connect with your team going forward to make sure that they are physically and mentally well at work.
Yeah, I lied. I'm going to ask one more question. Elaborate on that EAP real fast. What's an EAP to the viewers out there?
There's certain resources that they offer for employees. Some of them have like legal resources that they need it. Some of them have referrals to like mental health professionals and so on and so forth. And so it's really like a reference bank for the most part that you can, and it's generally inexpensive. It's not like you're paying for them to go to the therapist, but something you can direct them to if they've been a victim of domestic violence. That's something that's been coming up quite a bit with everybody being at home so much that domestic violence cases are escalating. And so those are places you can refer them to and have that EAP for them to work with.
That's great stuff. Kara, we definitely appreciate it. Bill, you can probably agree. We preach to our clients, don't wing things in your business. I will say there are some things you can wing in your business. HR is definitely not one of them.
No.
Do not try to wing HR by yourself. Reach out to a professional. Kara, just let us know, or kind of end on, what is your typical, we hit on this at the beginning a little bit, typical relationship with a dental practice owner, the services, what's that looks like, and then tell people how they can reach out and contact you.
It can vary. I generally do a renewable retainer agreement where they can use me for whatever services they need. If they want me to go through a handbook, I can do that. If they want me to be there for some employee relations questions, it's been the big thing right now. I'm certainly available for that. If they want to just meet quarterly and go over what they have and what they're working for, if they're looking to hire or expand their workforce, there's a lot of things in HR that I can certainly work to address. And so I try to do that one-on-one with the practice leadership as best possible. And I know everybody's crazy busy and crazy stressed right now, but it's definitely something to prioritize, and I'm happy to help. I'm always here for clients.
Yeah, that's awesome. Kara, we appreciate your time for sure. As the year goes on, we'll probably reach back out and have you update us on, who knows, there's changes all the time. So we'll definitely reach out. Great resource full of gold nuggets. So we definitely appreciate your time. Perfect. So for everybody out there too, I want to share one or two quick things real fast. So if you enjoyed what you listened to today, I'm sure you did, just do two things. First off, leave a review for us, share it with a friend, but then also subscribe to the podcast channel on Apple Podcasts, Spotify, or wherever you're listening today. We're going to be doing a whole lot more of these guys. We're bringing in professionals just like Kara who are full of gold nuggets, try to help dental practice owners out there gain momentum in their business so that they can achieve the practice they deserve. So Bill, Kara, appreciate your time. Everybody else, have a great week. We'll talk to you guys soon. Take care.